So good morning, everybody. Today our topic is intracranial hypertension. Before we studied the intracranial hypertension, we have two concepts to make sure. The first one is intracranial hypertension. Another one is intracranial pressure. These two concepts is too different to discuss. As we know, cranial brain includes cranial cavity and intracranial contents, which are located inside the cranial cavity. So we should know the anatomy of central nervous system before we study the intracranial hypertension. Intracontent also include brain tissue, cerebral blood, and cerebral spinal fluid. These three, brain tissue, cerebral spinal fluid, and blood, are also located inside the intracranial cavity. Now we study the concept of the intracranial pressure, which is different to the intracranial hypertension. The pressure arises from the contents inside the cranial cavity against the skull. We call this pressure intracranial pressure. Usually the intracranial pressure is represented by pressure inside the subarachnoid space and measured through by lumbar punch when patient is placed in the lateral decubitus position. So usually the pressure inside the subarachnoid space is represented to intracranial pressure. And how to measure the intracranial pressure? Usually the intracranial pressure is measured by lumbar punch when patient is placed in lateral decubitus position. And for adult patient, the intracranial pressure is 80 to 180 milliliter water. It's also 0.7 to 2 kPa, 5 to 15 milliliter mercury. For child patients, the intracranial pressure is 50 to 100 milliliter water, or 0.5 to 1 kPa. Now we study the intracranial hypertension. The definition of intracranial hypertension is that intracranial pressure keeps on high status of more than 200 milliliter water or 2 kPa and results in a series of corresponding syndrome. So we call this syndrome as intracranial hypertension. Etiology and pathophysiology of intracranial hypertension. The first causes of intracranial hypertension is intracranial occupying disease. Intraoccupying disease include brain tumor. We can see here, this is a brain tumor inside the brain tissue. Also include hematoma. We can see here, intracranial hematoma. Sometimes it also include brain abscess and brain inflammation and so on. Intracranial occupying disease not only result in the mass effect, but also can cause the brain edema. Sometimes it also causes cerebrospinal fluid drainage obstruction. So all these reasons can cause the intracranial hypertension. So the first causes of intracranial hypertension is intracranial occupying disease. This picture shows intracranial tumor, we also call brain tumor. We can see here mass. After contrast, the mass enhanced obviously. We call this mass is meningioma. Meningioma has mass effect. Midline shift to another side, and the intracranial pressure is very high. So the patient have clinical manifestation like a headache, vomitus, or other signs. So this is intracranial tumor. The second cause is volume increase of the brain tissue. So most of the reason of volume increase is brain edema. Depending on location, size, and etiology of brain edema, we usually classify the brain edema into intracellular edema, extracellular edema, or local edema, diffuse edema, or cytotoxic edema, vasogenic edema, and ischemia edema. This picture we can see here. The patient suffered brain injury, and after several days surgery, and brain edema we can see here. So a little bit, the midline shift to another side a little bit. So this is second cause of the intracranial hypertension, is volume increase of brain tissue. We also can see brain edema in this picture. The brain edema around the hematoema, and the brain tissue will compressed, and the brain tissue will shift a little bit to another side. We also can see brain edema in this picture. Brain edema around the mass. We call this mass is brain abscess. Brain abscess can cause the brain edema very obviously. As the third cause of intracranial hypertension is increase of the cerebrospinal fluid volume. Usually, cerebral fluid, we call CSF, is secreted by colloidal plexus. When there is inflammation or in tumor or brain tumor in colloid plexus, the colloidal plexus will increase secretion of the CSF. Also, the CSF is absorbed by arachnoid villi and venous sinus. If there is subarachnoid hemorrhage or venous sinus obstruction, the absorption of the CSF decreased. Another reason is the circulation disorder, CSF circulation disorder. Sometimes brain tumor can obstruct the CSF drainage, and the circulation will be obstructed. We call it the circulation disorder. So the absorption decrease, circulation disorder, and the circulation increase. All these three reasons will cause the increase of the cerebrospinal volume. This is the third reason for intracranial hypertension. This picture we can see hydrocephalus in this boy. Hydrocephalus in this boy. What reason caused hydrocephalus in this boy? The reason is the boy suffered from congenital aqueduct stenosis. This congenital aqueduct stenosis obstructs the CSF drainage duct and cause CSF circulation disorder. So this patient suffered hydrocephalus. The fourth causes of intracranial hypertension is increase of the cerebral blood flow, CBF. CBF increase may caused by inflow increase or outflow occluded. Inflow increased may be related to blood vessel dilation. Now, how blood vessel dilation? Usually, blood vessel is dilated by carbon-oxygen accumulation or injury of the vascular regulation center in the hypothalamus, and so on. Outflow occluded is usually caused by venous drainage occlusion, usually thrombosis inside the venous sinus system. So this is the fourth causes of the intracranial hypertension, increase of the cerebral blood volume. Cerebral blood flow. We can see this picture here. There is a cerebrovascular malformation. Cerebrovascular malformation. The black film in here. This is cerebral blood flow increased very obviously. During operation, we can see malformation here. From radiology, we can see hematoma caused by the malformation. So CBF increased, intracranial hypertension occurred. Now we studied the regulation of the intracranial pressure. The first regulation is cerebrospinal fluid. How cerebrospinal fluid regulates the intracranial pressure? Cerebrospinal fluid accounts for 80% compensation of intracranial pressure. If intracranial hypertension increased, the CBF, cerebrospinal fluid, will decrease sedation. Meanwhile, increase absolution. And also, the cerebrospinal fluid is compressed into spinal canal. So with this regulation, intracranial hypertension will be decreased or will be regulated. So the first regulation is cerebrospinal fluid. The second regulation of intracranial pressure is CBF, cerebral blood volume. CBF regulation includes two items. The first item is auto-regulation of cerebral vessel. The second item is Cushing reaction. How the cerebral blood flow regulated the intracranial pressure? We can see some form here. CBF equal MEP minus ICP by CVR. CPP equal MEP minus ICP. CBF equal CPP by CVR. CBF is cerebral blood flow. MEP is mean arterial blood pressure. ICP is intracranial pressure. CVR, cerebrovascular resistance. CPP, cerebral perfusion pressure. So this relationship between CBF, CPP, CVR, and MEP, and so on. So this is the change of the cerebral blood flow. It means to regulate the intracranial pressure. Now what's Cushing reaction? If the intracranial pressure increased very high, sometimes higher than 35 milliliter water, so the auto-regulation of blood vessel disappear. And at this time, Cushing reaction will be reactive. Cushing reaction is characterized by hypertension, bradycardia, and also respiration change, pulse pressure increase, and other vital signs change. So this is the symptom and the signs of the Cushing reaction. Cushing reaction aimed to increase the blood flow and protect the brain tissue after the intracranial hypertension. So this is the Cushing reaction. Now we look at the curve between cranial cavity volume and the intracranial pressure. From this curve, we can see if the volume increased less than 8 milliliter, 6. If the volume increased less than 6 milliliter, the pressure increased not so much. However, if the volume increased more than 6 milliliter, like 7 milliliter, 8 milliliter, the intracranial pressure will increase very obviously. So this is a classic curve representing the relationship between intracranial volume and intracranial pressure. This is the volume pressure curve. Now let's study the clinical definition of intracranial hypertension. Headache. Headache is the most common symptom of intracranial hypertension. Sometimes headache has different level. Usually in the morning and in the evening, the headache will be heavier. And in the afternoon, the headache will be relieved. And the headache most happened in frontal side, temporal side, and sometimes from cervical occipital leading to the eye. And the degree of headache is related to the intracranial hypertension level. So this is headache, and it's most common symptom of intracranial hypertension. The another manifestation is vomit. Vomiters usually is projective, and this vomit has no relationship with meal, though it's often happens after meal. And the vomiters usually cause body weight loss, sometimes water electrolyte disorder. So this is another clinical manifestation, vomiters. Papilledema. Papilledema is one of most objective signs of the intracranial hypertension. So this is the objective signs. If the patient has objective signs like papilledema, we can see this patient have intracranial hypertension. But if the patient have headache or have vomiters, we cannot see this patient have intracranial hypertension. So if we find the patient with objective signs like papilledema, so the patient has intracranial hypertension. From this picture, we can see this is papilledema right here. Papilledema. Diagnosis of intracranial hypertension. The diagnosis of intracranial cranial hypertension depends on history, signs, and examination of patient. Examination of intracranial hypertension depends on LP, which is lumbar punch. Lumbar punch can measure the intracranial pressure. CT and MRI scan, which can find